A very good afternoon to our beloved lecturer, Madam Mazwin, and to my beloved friends. By the way, my name is Eli Kid Morris, and I am from DPH Cohort 18, and I'm currently studying at KPJ International College, Penang. So today, the topic that I would like to discuss is about Pharmacology 1 individual video presentation. So I'll, Now I would like to explain about the basics of pharmacology. So based from the video, the terms used in the videos are the receptors, especially the agonist and the antagonist, the drug cycle, which is the pharmacokinetics, which includes four of them. So for example, absorption, distribution, metabolism, and excretion. So what is the definition of excretion? Based from the video. So excretion is how the drug is removed from the body as waste. So now I would like to explain about the example of a drug based from the video assigned. So for example, oral dosage tablets or capsules such as indomethacin, which is a non-steroidal anti-inflammatory drug. So it is the most efficient and accurate approach to deliver a dose, since the drug enters systemic circulation without the delay caused by an absorption process, producing therapeutic impact faster than any other route. So the learning point based from the video given is that we learn about drug receptors such as the agonist, antagonist, and the receptor activity, the drug action, and analyze the side effects from the video. And pharmacokinetics, which is the drug cycle, is another something that we look into. For example, the distribution, metabolism, excretion, and absorption. And also the special delivery into the bloodstream. Absorption route, absorption time, and absorption factors are all the things that the body does to the drug. And for distribution, it has a distribution barrier, such as a drug delivery blood-brain barrier, a blood placental barrier, and a blood testicular barrier. And we can examine the breakdown to a less active or inactive state in metabolism, or known as biotransformation, an organ that includes the livers in most medications, for example, and kidneys and also intestines. So additionally, we study the excretion, which is the process of eliminating waste items from the body. So the organ that works, as well as the saliva, sweat, glands, lungs, and the rest is the kidney, right? So let's move on to the absorption. So from the video shown, so the terms that are used are the process of transporting an unmetabolized medication from the point of delivery to the circulatory system of the body, the duration of the drug circulation, and also the cost for the route of administration and its side effects. So based from the video shown, the definition for oral administration is the most prevalent method. This medicine travels through the digestive system, where it is absorbed by the gut and then distributed throughout the body. So the rise in the blood concentration takes some time to slow down and show a note that the circulation system is too slow and takes too long to process. So this is the definition of the time of the drug circulation. So the intravenous route will not take as long as the oral route, but it will provide the same dose. Nevertheless, the dose will not be metabolized in the intravenous or IV administration medicine. Because it's traveling to the heart, lungs, and back to the heart and to the artery, the system didn't take long. So as a result, the drug concentration quickly increased. So as a continuation, many of them are now providing the medicine in an inhaled form. So only the heart and the arterial circulation are affected by the drug. This indicates that even if the circulatory system is too rapid and the period is too short at this route of administration, the medication will shoot up very soon. So as an example, oral tablets such as paracetamol or acetaminophen tablets, and ibuprofen tablets. So when you take oral tablets, the process begins with the flow of blood from the gut and to the liver via the teleportal system, and then it flows from the liver, which is back then to the heart vein circulation and into the right side of the heart, then into the pulmonary artery and to the lungs, which is then goes from the lungs to the left side of the heart and finally out of the artery circulation. So based on the video given, the learning points would be the medication must be administered at the right time, dose, and route. And either the most effective route or the same dose will result in high risk or adverse effects, or simply known as side effects. And the administration route has its own part to take, but it follows the artery circulation system in the body. So let's move on to distribution. So the terms used in the videos are the purpose of distribution, the process of distribution, and includes the four compartments that involves the distribution process. And also, last but not least, volume of distribution and factors of distribution. So the definition of volume of distribution is a hypothetical volume of fluid into which a drug is distributed. So let's say once absorbed into the plasma, a drug can be distributed to one of the three or all three distinct fluid compartments. For example, plasma compartments, which consists of 6% of the body mass, extracellular fluid, which consists of 20% of the body mass, and last but not least would be the intracellular, which consists of the 60% of the body mass. So based on the video as assigned, the example of the drug would be intravenous. Okay, so let's say when intravenous IV, such as doxorubicin, which is a chemotherapy medication, is inserted into the blood plasma, the drug associated by binding molecules with proteins such as albumin. So let's say when the rest of the unbonded drug is then removed into the new compartments such as the extracellular fluid, fat, intracellular fluid, and others such as the CSF, peritoneum, synovial fluid, and also the fetus. So this process continues until there is a balance in each compartment. So therefore, an equilibrium constant is achieved. So the learning points based on the video given is that the objective of distribution is to balance the compartment with an unbalanced capacity. So the volume of distribution, or known as like VD, is a pharmacokinetic parameter representing an individual's drug propensity to either remain in the plasma or redistribute to other tissue compartments. By definition, VD is a proportionality constant that relates the total amount of drug in the body to the plasma concentration of the drug at a given time. So the balance of each compartment is represented by a number at the back or front of the equilibrium constant. So moving on to metabolism. So the terms based on the video, the terms used will be these enzymes in the liver, such as the CYP, or known as the cytochrome P450. Okay, you can see CYP, and also UGT. Okay, and also it involves the terms used would also involves the metabolism process, which are known, for example, as oxidation, hydrolysis, hydroxylation, condensation, and reduction. So in the liver, enzymes such as cytochrome P450 or CYP causes the drug to undergo a hydroxylation, which causes the hydrogen, that is attached group turn into a hydroxyl group, which is an OH. So through the action of UDP, glucuronyl transferase, or known as UGT, causes the attachment of the glucuronic acid group on the drug. This makes the molecule very water soluble or hydrophilic. So thus the drug can be filtered and can be easily secreted to the excreted. to the kidneys. So the definition used in the video, for example, in pharmacokinetics, metabolism is an inactivation of medications by the enzymes. So this occurs primarily in the liver, while other organs may be involved, include the GI tract, the lungs, and the kidney. Therefore, if a drug has been metabolized, it has been rendered inactive by the process of metabolism. So one of the example of like based from the video as shown is like oral tablets such as the aspirin undergoes phase 1 metabolism, in which involves CYP enzyme hydrolyzing the aspirin molecule, resulting a product called salicylic acid. And resulting after that, with the help of UDP-ST enzyme, causes the attachment of the glucuronic acid group on the salicylic acid, which then eases the drug to be excreted to the kidneys. So, based from the video given, the learning points are the enzymatic modification of substance drug is referred to as metabolism. And there are two enzymes involved in phase 1 and phase 2, which are the CYP and the UGT, that aids the drug in order to be filtered and excreted easily to the kidneys. And drugs are metabolized through various reactions, including oxidation, hydrolysis, and hydrolysation. And last but not least would be excretion. So the terms used in the video are the hepatobiliary system, the route of excretions, which are the major ones such as the bile and the renal, and the renal elimination of drugs, which includes like several parts such as the glomerular filtration, proximal tubular secretion, distal tubular reabsorption. And last but not least, the term used based on the video given as shown is the clearance. So the definition in the video, based from the video, is clearance. One of it is clearance. So clearance is the volume of plasma from which the drug is completely removed per unit time. So the amount eliminated is proportional to the concentration of the drug in the blood. So we move on. So as an example, through nephron, when drug is reabsorbed, its concentration in the urine decreases and the clearance of the drug will be reduced. However, if the drug is secreted into the nephron, its concentration will increase. Same goes to the clearance that will increase. So an example that is actively secreted into the nephron is penicillin, which is administered parenterally. It could be either intravenous or intramuscular. So the learning points based on the video given. So the concentration of the plasma is dependent on the amount of dose of the drug given. So therefore, high concentration of plasma causes faster rate of drugs to be excreted. So besides that, they have also point out about the first order kinetics and zero order kinetics. And reabsorption or secretion may happen in the nephron depending on which type of drug, right? So individuals with kidney disease will have a lower glomerular filtration rate, or known as GFR, in which will cause a lower clearance. So that is all from me. Thank you for watching and listening.